Hello, this is a video lesson on anatomy of the vertebral column. To begin with, the anatomy of the vertebral column forms the central axis of the skeleton. It's centered in the mid-sagittal plane of the posterior part of the trunk, and its functions are to enclose and protect the spinal cord, to support the trunk and the skull, and to provide attachment to muscles and ribs. As you can see, we have the cervical, thoracic, lumbar, the sacrum, and the coccyx. And then we can see that the cervical spine is convex anteriorly and is a lordotic curve. The thoracic spine is concave anteriorly, is a kyphotic curve. The lumbar spine is convex anteriorly, is a lordotic curve. And then the pubic curve is concave anteriorly and is a kyphotic curve. So the vertebral column is composed of small irregular bones called vertebra. There are 33 total vertebrae in early life. There are between the cervical, thoracic, and lumbar, there are 24, since there are 7 cervical, 12 thoracic, and 5 lumbar vertebrae that are true movable vertebrae. The sacral and coccygeal segments are false fixed vertebrae, and the 5 sacral segments fuse into one bone called the sacrum, and the 3 to 5 coccygeal segments fuse to form one bone called the coccyx. The vertebral column is divided into 5 groups named according to the region they occupy. As I mentioned before, there are 7 cervical, 12 thoracic, and 5 lumbar, 1 sacrum, and 1 coccyx. There are 4 curves. The kyphotic curves are concave anteriorly, and they are primary curves that are present at birth, and that includes the thoracic and the pelvic curve. The lordotic curve, which are the other 2, are convex anteriorly. They're secondary or compensatory curves. The cervical develops when an infant begins to hold the head up at 3 to 4 months of age and sits alone at about 8 or 9 months. The lumbar develops when the child begins to walk at 1 to 1.5 years of age. Scoliosis is the condition of the abnormal lateral curvature of the spine. Kyphosis is an abnormal increase in the anterior concavity of the thoracic spine and is best visualized on a lateral projection. And lordosis is an increase in the anterior convexity of the cervical or lumbar spine, more commonly lumbar, and it is better visualized on a lateral projection as well. And here are images of scoliosis, for example, and also the kyphosis. And as you can see, scoliosis is best visualized on an AP or PA projection. The main parts of the typical vertebra is that, first of all, are the anterior mass called the body, which is shown in yellow, and then the anterior ring-like portion called the vertebral arch. And that's this posterior portion that we have that includes quite a few different parts. The 2 parts enclose a space called the vertebral foramen, and that's the part that's in the center that's going to be the location for the spinal cord. And it's the articulation of vertebral foramina to form the vertebral canal. The intervertebral discs separate the vertebral bodies and they function as cushions. The disc is composed of annulus fibrosus, which is an outer fibrocartilaginous disc, and the nucleus pulposus is a soft, pulpy, semi-gelatinous material. The term HNP is a herniated nucleus pulposus, and that's where the pulpy nucleus ruptures or protrudes into the vertebral canal, impinging on a spinal cord, and that is called a slipped disc. The vertebral arch is formed by 2 pedicles, which are one on each side. There are short, thick processes that project posteriorly, one from each side, from the superior and lateral parts of the posterior surface of the vertebral body. There are vertebral notches, inferior and superior, that form because of the pedicles being concave. There are also 2 lamina. The lamina are located posteriorly immediately from the pedicles, and in the image up here they're shown in red. And here it is, doesn't really show it too well, but approximately this area here for the lamina. The pedicle and lamina support 4 articular processes, 2 transverse processes, and 1 spinous process. So here's the body of the vertebra. Here's one pedicle, and here's the other. The vertebral foramen can be seen here. The lamina can be seen on either side, and we have 1 spinous process. We also have 2 superior articular processes and 2 inferior articular processes, which we'll talk about shortly as well. And this picture shows the picture of the superior vertebral notch, which this is the pedicle, and the inferior vertebral notch, and those form the intervertebral foramina. The transverse processes project laterally and slightly posteriorly from the junction of the lamina and the pedicles. They're shown here in pink. There's 2 of them. The spinous process projects posteriorly and inferiorly from the junction of both lamina. Spina bifida is a condition in which a congenital defect in which the vertebral column in which the lamina fails to unite posteriorly at the midline. In serious cases, the spinal cord may protrude from the affected individual's body. The intervertebral foramen, as I mentioned in the previous slide, are formed from the vertebral notches of the vertebra above and below, and it allows transmission of spinal nerves and blood vessels. The 4 articular processes that arise from the junction of the pedicles and lamina are the 2 superior articular processes, and there are 2 inferior articular processes. There are facets that are fibrocartilage covering the articulating surfaces of the 4 articular processes, and the articulations of the vertebra above and below form the zygapophyseal joints, also known as interarticular facet joints. So cervical spine anatomy. There are 2 unique features of the cervical vertebra. First of all, they have transverse foramina. That's unique compared to all other vertebra. And secondly, they have a bifid tip for their spinous process. C1 and C2 are atypical to join with the skull, and then C7 is atypical and slightly modified to join the thoracic spine. So C1 is called the atlas. It consists of an anterior arch, which is shown here. It consists of a posterior arch. It consists of 2 lateral masses, which are at the sides, and then 2 transverse processes. It has no body. It has a short spinous process. There is a short spinous process there, and has a superior articular process and facets that receive the occipital bones, which are shown here. It receives the odontoid process from C2. The C2 is the axis. It has the dens or the odontoid process is the part that's going to move up into the C1, the anterior aspect of it. It's a strong conical process arising from the upper surface of the body of C2. It's received into the anterior ring of C1. The superior articular processes, which are the side of the dens, are adapted to join with the inferior articular processes of the atlas. The lamina are very thick and broad, and the spinous process is horizontal. And here's C1 and C2. You can see the lateral mass of C1 over here, and here's the other one. And here's the odontoid process, which is the conical process that's from the body of C2. C3 to C6 are very much alike. They have a body. They have the foramen for the artery and vein transmission, the transverse foramen, transverse process, the pedicle, the superior articular processes, otherwise called facets, the vertebral foramen, the lamina, and then the spinous process, which again is a bifid tip. C7, the difference between it and C3 to C6, it has a long spinous process, and that is a very prominent process, which is why it's called the vertebral prominence. It's easily palpated. The intervertebral foramina, since this patient is if we're looking at the spine right now, we're in an AP projection. The floor of the intervertebral foramen, which is going to be the location of the pedicle, lies at a 45-degree angle to the mid-sagittal plane. So that's why we do our obliques at 45 degrees. And they're going to open away from the image receptor. So this is the location where we're going to be opening up, and so we can see our intervertebral foramina on the side up. The patient is facing to the left, so this is an LPO position. And with it being an LPO position, we're seeing the right intervertebral foramina on the cervical spine. The zygohypophyseal joints are going to open at a 90-degree angle from the mid-sagittal plane, and that's the articulation. Zygohypophyseal joints are the articulation of the superior and inferior articular processes of one above the other, and we're going to be able to turn the vertebra to the side so we can see how it has to turn 90 degrees, which is into a lateral projection. The thoracic vertebra occupy the posterior thorax. Unique features is that they have costal facets on the posterior lateral sides of the bodies for articulations with the head of the ribs, and they have facets on the transverse processes for articulation with the tubercle of the ribs, for example, T11 and T12. And so they're on the thoracic vertebra. They do have facets, whole facets and demifacets. Here's an example of a whole facet for articulation with a rib. Here's a demifacet down here on the body of the vertebra for articulation with the head of the ribs. And this is the transverse process with a facet for articulation with the tubercle of the rib. And so here's the thoracic vertebra, just showing it from the side view. Looking at the body, here's the costal facet or the demifacet for the head of the rib. And here's your superior articular process, inferior articular processes, the lamina, the longer spinous process that is going to be more positioned more inferiorly. And we have the costal facet for the tubercle of the rib, and then the pedicles over here. Here's a different view of the thoracic vertebra. So keep in mind that you're going to have little grooves in the pedicles. That's going to give you your intervertebral foramina. And then you have, of course, the facets that are showing up again on here. The intervertebral foramina for the thoracic spine are going to open at a 90-degree angle from the mid-sagittal plane. So you have to turn your vertebra 90 degrees, which is into a lateral projection, to see the intervertebral foramina of the thoracic spine. So you can see the intervertebral the thoracic spine on a lateral projection, which means that the patient's body is turned 90 degrees. In the articulation, the vertebral notches form the intervertebral foramina. On the lumbar vertebra, they occupy the posterior abdominal region. The thoracic processes are a little smaller than the T-spine. We'll take a look at those here. And the pars interarticularis is a part of the lamina between the superior and inferior articular processes. So here's the lumbar vertebra. It still has the body. Here's the pedicle, which we're going to get our inferior and superior vertebral notches, which gives the intervertebral foramina. We have the transverse process, the lamina on both sides, and then the spinous process as well. The spinous process is much more broad and not positioned as inferior as the thoracic vertebra were. And so if we're looking at zygohypophyseal joints are opening up from this is in an AP position. So from an AP position, we're opening up 30 to 60 degrees, and that's where the superior articular processes and inferior articular processes are located. So we turn our patient into an oblique. We're turning them at a 30 to 60 degree angle, and we're looking at the side down. So zygohypophyseal joints are articulation of the inferior and superior articular processes, and that's this location right here. It's just an open little joint space there. We're looking at the ear of the Scotty dog forming the superior articular process, and the leg of the Scotty dog, here's another zygapophyseal joint, forming the lower part. The eye of the Scotty dog is the pedicle, which is the part that we're going to want to center in the center of the vertebral body during the positioning. The nose is the transverse process. The pars is the neck, and the lamina is the body. And so we can see our Scotty dog, we can see the Scotty dog present, as well as that zygapophyseal joint on our lumbar obliques. On the intervertebral foramina of the lumbar spine, we're going to have to turn the vertebra 90 degrees from the mid-sagittal plane in order to see the intervertebral foramina, just like we did on the thoracic vertebra. And the notches that form the superior and inferior vertebral notches are what form the intervertebral foramina. The sacrum is formed by the fusion of 5 sacral vertebral segments into a curved triangular bone. It's wedged between the ilium of each hip bone, and the articulation is called the SI joint or sacral iliac joint. The top part is called the base. We've got the sacral promontory, which is the superior portion of it, and the prominent ridge. The ala is the wing-like lateral mass. There's one on each side. The sacral canal is the part that's going to transmit sacral nerves. It's down here. Sacral foramina, there's several sacral foramina that we can look at here, and those are passage of sacral nerves and blood vessels as well. And the apex is at the bottom, just like the knee. The sacrum, just looking at it from the side view, we're able to look at the sacral canal from this viewpoint, and then you can also see the articular processes that for it in the auricular surface, which is going to join with the ilium. The coccyx is formed by the fusion of 3 to 5 rudimentary vertebrae. It curves inferiorly and anteriorly from articulation with the sacrum, and it has a coccygeal cornu. So the most superior portion of it is the apex again, just like the sacrum, and the bottom portion is called the apex, just like the sacrum as well. SI joints are articulation between the iliac of the sacrum, of the pelvis and the sacrum. So we've got this bone touching bone over here, and this one on the CT scan, but over here on this one on the left, a patient's left side, is unaffected side, there's not a problem. So we've got these SI joints that lie at a 25 to 30 degree angle in the patient's body. And so taking a look at our joints, there are certainly ones that are important. We need to know that the atlanto-occipital joint is the one between the atlas and the occipital bone. It is an ellipsoidal joint. The atlantoaxial joint on the lateral masses is gliding, but the actual where the dens is a pivot joint. The intervertebral joints, which is between the vertebra, are cartilaginous. They're symphysis joints. And then the zygapophyseal, costovertebral, and costotransverse joints are all gliding joints. And this concludes our video on the anatomy of the vertebral column. Have a great day.